Hello all, this is Dr. Alsup again, and we are going to continue our discussion on the bones of the skull, and we're going to focus on the facial skeleton or the viscerocranium. And recall that we discussed the differences here. So the neurocranium is going to involve all those bones that are really playing a role in terms of the protection of the brain. Whereas the viscerocranium is more associated with the bones associated with the face, and this will include the mandible, which is that lower jaw region. So we're going to focus on these bones. These are mostly irregularly shaped, and many of these will be paired. But the first one that we're going to talk about is the vomer, and the vomer is not paired. There is only one. And it will match up, and you can see the vomer right here in this image. This is kind of plow-shaped bone right here. It's going to form the inferior portion of the nasal septum. And you can see the nasal septum is this thing that kind of splits the nasal cavity into two different sides. It will be made up of the ethmoid superiorly, and we talked about that ethmoid when we were talking about the neurocranium. So the ethmoid will be the superior portion here. The vomer, which is part of the facial skeleton, is going to be the inferior portion. And the majority of the anterior portion of the nasal septum will actually be cartilage, which you don't see here on the dry skeleton, obviously. But during life, you would have cartilage in this area. And so if you have a deviated septum, this would mean that some portion of that nasal septum is going to deviate either to the right or the left side. Oftentimes, it's the cartilage that actually is going to deviate. All right, looking into that nasal cavity region, you will see these odd shapes. So this is the nasal cavity that I'm outlining, and you'll see these kind of odd shaped bones right in this region. And these are referred to as nasal conchae. It gets the name from the concha means shell or kind of shell shaped. And these are very, very thin bones. You will see that there are actually going to be three sets of bones. They're the superior and middle nasal concha, which you can see here and here. These are actually components of the ethmoid bone. So I told you that ethmoid bone in that previous video when we were talking about the neurocranium is a very complex bone. So it'll actually have some components of it that form these concha. And then you'll have this larger inferior nasal concha, which is what we have shaded in blue here. And then the inferior nasal concha are separate paired bones, so these are their own bones. It's not of another bone like these are of the ethmoid. And like I mentioned, these are going to be kind of shell-shaped or concha-shaped. They are extremely thin bones, but they will be lined with mucous membrane. And what these bones do, because of the mucous membrane that kind of lines it, it's going to really increase the surface area in the nasal cavity. And so as you kind of have air moving into the nasal cavity region, this will help to kind of make the air a bit more turbulent. It will play a role in terms of moistening and humidifying that inhaled air before it gets back towards the rest of the airway pathway. Okay, so here again, here's that ethmoid bone, here is the vomer. Let's look at these superior bones that are going to form the bridge of the nose, and these are the paired nasal bones. And these are fairly nondescript bones. They are a little on the thin side as well. I kind of think of these bones as if you put on a pair of glasses, they're sitting right there on top of your nasal bones. Okay, moving to one of the more complex sets of bones of the viscerocranium, of the facial skeleton. And these are the maxillae, or you'll often hear me say maxillary bones. And these are going to be your upper jaw bones. So you'll have two of these, whereas you only have the one mandible, which in a juvenile actually was split into two. And importantly, these maxillary bones are going to house the maxillary teeth. And you can also see, and we'll come back to these teeth in a bit more detail. We'll talk about the different types at the end of this video. But I do want to focus on this hard palate region. So we're looking at the inferior portion. If you put your tongue on the top of your mouth, you can feel the hard palate. All right? The majority of the hard palate is actually the maxillary bones. This more posterior portion is going to be the palatine bones. And you would think, okay, the palatine bones would make up the majority of the hard palate because palate's right there in the name, but it's actually these maxillary bones they'll make up the majority of the hard palate. And then the soft palate would be located kind of extending off of the hard palate, and it will be made up of muscular tissue, as well as it will have some connective tissue lining around it as well. Now, failure of those palatine processes of the maxillary bone, so we could see kind of right around this region, those palatine processes. If you do not have those processes that are going to unite, this can cause what's referred to as a cleft palate. And so you can see that it just looks like that there was an incomplete fusion and an incomplete creation of the bone around this region here. Now, these two areas can be kind of joined together through surgery, and typically it's not very obvious that this was the case in a juvenile. So with a early intervention, that can there'd be very little remnant of a cleft palate. Okay, the zygomatic bones, a lot of times it gets its name being kind of yolk-like, but I like to more colloquially refer to these as your cheekbone. So if you're feeling your cheeks, if you ever put kind of blush in that region, it's kind of going over those zygomatic bones. Also, okay, if we're looking in the orbit region, a good majority of the orbit will be zygomatic. You can see it's going to form a little bit of that there. The maxilla will head into this region. The frontal, you'll have some other bones towards the back, with the ethmoid and the sphenoid. But in this medial portion right here, you have the maxilla, and then you're going to have this kind of tear-shaped bone right here, which is the lacrimal bones. All right, so the lacrimal bones, they're paired, so you have two of those. And these will be in the medial portion of the orbit. Now, it gets, lacrimation means tears, and you'll actually have the lacrimal gland will kind of sit in this region during life, which is lateral. And then tears will be secreted from the lacrimal gland and eventually make its way over towards the lacrimal bone and the lacrimal fossa, which is kind of this area between the lacrimal bone and the maxillary bones. And this is where those tears will eventually make their way to and drain towards the nasal cavity. And you can see here on this image, so the lacrimal bone is right here, and you can see that it has been fractured in certain areas. This is post-mortem or after death, but this bone is particularly thin in comparison to most other bones of the facial skeleton. Now, in certain bones, there are relatively hollow areas that are going to be mucous membrane lined. All right? And so these are referred to as the paranasal sinuses. And you're going to have four major paranasal sinuses associated with four bones. The largest and the most prominent are going to be the maxillary sinuses. So these will be in a hollow portion within the maxillary bones. You'll also have the frontal sinuses, which often are kind of subdivided. You will have the sphenoid, and you will have ethmoidal, kind of air cells, similar to what we had in the mastoid process over here. And these, like I said, are mucous membrane lined, and if there's any collection of mucus, this will drain into the lateral nasal wall. So if you have sinusitis, or if you think my sinuses are acting up, a lot of what is occurring is that there's inflammation of the mucous membranes kind of surrounding the sinuses. It could be of only one sinus, it could be of the paired sinuses, or it could be multiple paranasal sinuses. And so you kind of have a thickening of the mucosa. It could end up blocking the sinuses from draining and can cause all kinds of issues. So if you hear an individual saying, you know, my sinuses, this is what they're referring to. All right, back to this image of the base of the skull. And this is really kind of going back to the basocranium as well, but we're kind of finishing off some of the last points that we want to get across regarding the skull. And these are the cranial fossae. And this is kind of almost a very stair-step appearance of where the brain would sit. And so what is happening are these cranial bones will actually form around that developing brain and create this kind of stair-step appearance. The anterior cranial fossa will be kind of the highest, so you'll have those frontal lobes there. Then you get to the middle, and eventually you get to the deepest and considerably deeper posterior cranial fossa. So you'll have that occipital lobe as well as the cerebellum in this region. So the reasoning behind this shape is just because of the shape of the brain. All right, last but not least, the mandible, so the lower jaw. And this is the only movable skull bone, except which small bones associated with the skull also move. We didn't really get into this, but those ear ossicles that are housed within that petrous part of the middle ear, they actually articulate with one another via synovial joints and with a sound wave kind of transmitting that force throughout those bones. So those bones do move, they are articulated by joints, and the only other movable skull bone is the mandible. So if you think of chewing or mastication, it's this mandible that's moving. And so here is the M portion of the TMJ. So the mandibular condyle is what's going to articulate with that mandibular fossa of the temporal bone. You can see it's nice and smooth here because articular cartilage sat there during life. Now this more anterior projection, kind of just anterior to the mandibular condyle, is the coronoid process. And this will be an inferior attachment for that temporalis muscle. I told you when you kind of put your hands on the side of your head and you clench your jaw, you feel that temporalis muscle contracting. And this is important. So this is a muscle of mastication, and there are 4 different muscles of mastication. We'll talk about each one of them, but they all have to have a distal attachment or an insertion site on the mandible, because when they contract, they're going to move the mandible, as this is the movable bone of the skull. Oops. Now what we're looking at here is a hemisected mandible. So what's been happened is the mandible has been cut in half, and now we're looking at kind of the inside of the mandible. And there is this important foramen here, and it will lead into the depths of the bone, so kind of into the bones. And what is going to transmit here, or is what is going to move through here, is what's referred to as the inferior alveolar neurovasculature. And the inferior alveolar nerve is actually what's going to provide the sensory innervation to all the teeth. So what a dentist or any type of surgeon that's going to do something in this area is trying to insert anesthetics, which you can see kind of right here, right around this region where the inferior alveolar nerve is heading into the mandible. So that's called an IAN block. So let's talk a little bit about the teeth. There are 4 types of teeth. There are the incisors, which are going to be the more thin kind of cutting edges. So you'll have central incisors and lateral incisors. You will have a canine, so one of each. You will have 2 premolars or bicuspids. All right, so 1, 2. and then you will have up to 3 molars in an adult dentition. So this would be your first, your second, and your third, aka the third are often referred to as those wisdom teeth. So not everybody has third molars. Either they don't erupt or they never formed, and many individuals have their wisdom teeth or their third molars removed. So in an adult dentition, there are 32 permanent teeth as long as an individual hasn't had any teeth removed or say they never formed. And what this right here is called the dental formula, and this is telling you how many of each type of tooth there is in a quadrant. Okay, so this is key here, a quadrant. So I'm looking at half of the teeth. These are the maxillary permanent teeth. These are the mandibular permanent teeth. And a quadrant would be kind of half of the half, right? Same thing down here. So what this is telling me here is that there are 2 incisors, 1 molar, 2 premolars, and 3 molars. And that would be the same in this quadrant, and that would be the same in this quadrant and in this quadrant. Now, again, this is if an individual had all of their adult dentition. Of course, people can have teeth removed, or they can be lost during life, or say they never formed or fully erupted. But this is kind of the full set here in a quadrant. When we're talking about deciduous teeth or primary, juvenile, baby teeth, you hear them many different ways. There will be 20 teeth in all. And so once again, here is the quadrants. I'm kind of split this up right here. So this is telling me that there are 2 incisors. There is 1 canine. And there are 2, and here is something interesting, 2 molars. Okay? So what type of tooth are we missing here? So we had the 2 incisors, 1 canine, 2 molars. What type of tooth is missing? That's those premolars that we had here. So we do not have premolars when we're talking about deciduous or primary teeth. So this is canines, incisors, and molars. Okay, so that will finish us off in terms of the bones of the skull. We will return to a lot of those landmarks in the laboratory videos. But here, let's review a question and see where we're at in terms of our knowledge here. If we miss it, no big deal. We know that's an area that we can focus on more. And if we get it, then we can kind of move on from that area. So question, most of the hard palate is composed, is composed of which bone or bones? Is it ethmoid, mandible, maxillary bones or maxillae, palatines, or vomer? Which one is it? All right, so kind of keys in the stem. Hard palate. So we know there, hopefully we remember there are 2 main bones associated with the hard palate. And also we have most. So ethmoid, it's not right. That's not going to make up the hard palate. Mandible, not right either. That's going to be lower jaw. Maxillae, maybe. Palatine, maybe. Vomer, not so much. So we're left with these 2. Which one of these 2 make up the majority of the hard palate? That will be the maxillary bones. So if, remember the maxillary bones, even though palatine has palate right in its name, it's going to form that posterior portion of the hard palate, and the soft palate will kind of hang off of that region. But it's really the maxillary bones that are making up the majority of the hard palate. All right, really good job there. Like I said, if you missed that, that just is an opportunity for continued review in that area. And we are going to move on to the joints of the head, and really, we're talking about one main one there. And so we will talk joints and then get to muscles to kind of put this all together. Thank you for your time and attention here, and have a great rest of your day.